Now, an important health initiative is underway across Africa this week. Joining us now is Africa 54's health correspondent, Linord Moudou. Lino.
Hello, Vincent. Hello, everyone. Well, this week around the world, people are commemorating World Immunization Week. And on the African continent, it is Africa Vaccination Week.
A shot and a drop. These simple acts can go a long way. Around the world, millions of children and adults are vaccinated every year to protect against various ailments. For newborns and young children, experts say immunization is critical to ensure that they grow up healthy to become healthy adults. The Gavi Alliance is a public-private partnership that focuses on increasing access to immunization in poor countries. Dr. Mercy Ahoun is the special representative to Gavi-eligible countries. She explains the benefits of vaccination.
Well, vaccination is one of the most cost-effective public health interventions. By vaccinating children, they are protected from the childhood diseases. It has been shown that their cognitive abilities is high. They are able to attend schools. They have access to education. Their poverty level is likely to be lower because they are exposed to education. The health of the child, they have chances of living longer and then serving their countries.
Vaccination provides the body with immunity against viruses that cause infections and diseases. The World Health Organization says every year, vaccinations protect an estimated 3 million children against diseases like measles, polio, and pneumonia. WHO says in 2000, measles took over 500,000 lives. In 2010, the mortality rate from the disease fell to 135,000, in large part due to vaccination. Dr. Jean-Marie Okwobele is the World Health Organization's Director of Immunization, Vaccination and Biologicals.
Individual protection, protection of communities, economic benefits. So one can list, why immunization is so important.
This week, people around the world celebrate successes made in immunization. It is also a time to address some remaining challenges. The third African Vaccination Week is celebrated from April 22nd to April 28th under the theme Save Lives, Prevent Disabilities, Vaccinate. Concurrently, World Immunization Week began on April 20th under the slogan Protect Your World, Get Vaccinated. Dr. Okwobele explains its purpose.
We want World Immunization Week to be an opportunity to celebrate the great benefits of vaccination, the great impact that one can get through vaccines. And actually the concept started in the Americas, where there are a lot of advances in the area of vaccination. They have eliminated polio, they have eliminated measles. They're looking at introducing many vaccines for their populations.
The World Health Organization says about 1.5 million children die each year from vaccine-preventable diseases. 17% of these mortalities occur among children below 5 years of age.
And joining us via Skype from Johns Hopkins University in Baltimore, Maryland, is Dr. Daniel Feikin, Director of Epidemiology at the International Vaccine Access Center at Hopkins Bloomberg School of Public Health. Dr. Feikin, welcome to the show.
Thank you.
So about 1.5 million children die from vaccine-preventable diseases. What do you see as some of the main issues?
Well, we like to divide up some of the problems into two categories. One is supply, and the other is demand. And the supply means we need to get the vaccines out to the clinics, out to the rural areas where children can get these vaccines. And up until recently, that's been a large problem. The transport, the cost, the cold chain, keeping the vaccines cold, that's improving. And much of it's improving with the funding from the Gavi Alliance. The second is demand. We need to make sure that mothers and fathers in places like Africa understand the value of vaccines and that they make it a priority to bring their children in to get vaccinated, even though we know they have a lot of competing priorities. They need to get firewood, collect water. They need to get their children into the vaccine clinics and get them vaccinated.
So according to statistics, pneumonia and diarrhea are responsible for 1/3 of deaths in children under the age of 5. Would you attribute the causes to what you just mentioned, or are there other causes?
Well, pneumonia and diarrhea are tricky because they can be caused by lots of different types of germs. So it's not so easy just to take one germ like malaria would be, for instance, and get rid of all of pneumonia. But the good news is, for the leading causes of pneumonia and diarrhea, we now have effective vaccines. And within the past few years, these vaccines have started to be rolled out in Africa and in Asia. And we see most countries now in Africa have taken the first vaccine against pneumonia, called Haemophilus influenza. They're in the process now of taking on the next vaccine against the germ called pneumococcus. And for diarrhea, the leading cause of death is rotavirus. And now there are 2 effective vaccines, and many countries in Africa over the next few years will be taking on those vaccines.
So when you look at the immunization landscape today, what do you see as the need? Where do you see needs to be scaled up? Do you see some priorities right now?
Yeah, I think we have the tools that we need right now. We have these effective vaccines. We know that if we can get children vaccinated, we will be able to reduce the number of deaths from the leading killers. But the problem still is many children in parts of low-income countries don't get vaccinated. The vaccines are there, but the kids are not coming into the clinic. So we really need to have a push to increase people's understanding of the value of vaccines and make it a priority, help them with financing when we can, remind them as much as we can, give them more knowledge about vaccines so that they start coming in for the routine vaccinations. There are still parts of rural Africa where fewer than 50%, fewer than half of the children get their routine immunizations. We also need new vaccines against some of the leading killers, and these are being developed for diseases such as malaria and tuberculosis. So there is room for research, funding into developing new vaccines and to getting children in for the vaccines that we already have.
Dr. Feikin, thank you so much. That's all the time we have today. Thanks.
Thank you.
And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.